Good afternoon. My name is Lance Truella. We're going to be talking about patient blood management today and the importance of blood transfusions. I am currently the lab director and the transfusion safety officer at Erlanger Health System. Patient blood management revolves around safety and quality. As we all know, blood is the precious resource that has saved many lives and will continue to do so. However, we have underestimated the true cost of a blood transfusion. The total cost of blood is approximately $1,200 for 1 unit of red cells and can exceed $2,000 for a unit of platelets. In addition, we have underestimated the overall risk of blood transfusions, ranging from Zika, babiosa, chikungunya, dengue, to name a few. In the last 5 to 10 years, we have also changed our threshold for when a patient needs a transfusion. The previous threshold was a hemoglobin of 10. The latest evidence proves that not transfusing until a hemoglobin of 7 is more beneficial to our patients. In addition, we have overestimated the clinical benefit of a transfusion. The purpose of a transfusion has been to increase end organ perfusion. However, with these patients that are being transfused at higher levels, we are not truly impacting and improving the patient's outcome. As we all know, blood is a liquid transplant. Whenever we transfuse somebody, we have to do a type and screen and a type and cross to validate that blood is appropriate for that patient. So specifically about diseases, we do evaluate whether or not a donor has babesia, if they've been exposed to chikungunya, most recently Chagas. As you can see from this illustration here, there's a picture of the kissing bug that is making prevalence now in the United States. In addition, dengue, malaria, and most recently Zika. Zika has added approximately a cost of $42 million to the entire country, with a total of 9 positive donors that have tested positive for Zika. So not only is the cost of blood going up, but the additional cost of tests that are required for products. The next one on here that is not an infectious complication per se, but it deals with bacterial contamination, probably the most common side effect or complication with platelets. Approximately 1 to 3,000 to 1 in 5,000 platelets can be contaminated. This can happen in the collection process where the donor is not prepped accordingly, or can happen in the pooling process if they use whole blood to collect platelets. In addition, anaphylactic reactions. This isn't something that we can necessarily prevent, but monitoring patient for any signs and symptoms and change in vital signs, specifically that increase in temperature of at least 1 degree. In addition, hemolytic transfusion reactions. This is where everyone in this room can play an impact on ensuring that the right patient is getting the right product. Specifically, labeling of the type and screen or type and cross tube at the bedside and validating that blood product is for that patient prior to transfusion. In addition, transfusion-related immune modulation has become very prevalent in patients that receive multiple transfusions. The more products patients receive, the more susceptible they come to having a reduced immunity. Another concern is patients that receive large volumes of fluid, specifically yellow products, particularly plasma, and platelets, and when they receive them too fast. This can cause transfusion-associated circulatory overload, also known as TACO. The X-ray over here to the right is a good example of Trolley, also known as transfusion-related acute lung injury. This can cause decreased lung function, and in this patient over here, decreased lung capacity. The last main concern isn't so much disease transmission, but the effect of the storage lesion. We know we can keep red cells for up to 42 days. However, the longer products are kept on the shelf, the opportunity for a storage lesion to develop, and sometimes the impact on patients can vary significantly. Here at Erlanger, we use a positive patient identification with a secondary armband. In addition to their primary armband, we use this armband to identify in a second form that patient. So to start, we obtain a regular patient armband, place that on the patient, and verify their identity. Once we are ready to dry, type, and screen, we grab one of these Type-NX blood bank armbands and place the armband on the patient with a chart label and use that as the second identifier. Once we draw that first type and screen sample, we place a chart label on the tube, and then we also place one of these Type-NX armbands on the tube as well to be sent down. It is imperative that we label the patient's chart, or label the patient's tube at the bedside and place the label where we are drawing it. In addition, we must write our phlebotomy code on the tube, as well as the date and time, and both need to be legible. If you are picking up blood from the blood bank, we have two different options for retrieving that blood. On the left here, we have a form that is specifically for the OR, emergent transfusions, including the ER, and downtime form in case of system is not working. It's most important that we include the patient's chart label, as well as their location, as well as the location that you can be reached at, and most importantly, the ordering provider. On the left here, you can select the products that you want, and if it is a massive transfusion, you just need to write which cycle we are on. Lastly, you include the blood bank armband number, which can be written in or use a sticker. If you are getting more than one unit, below you can select the type of cooler. Everywhere will receive, except cardiac surgery, will receive a 4-hour cooler. Cardiac surgery, we have a 12-hour cooler, which will allow the blood to be kept for a longer period of time. If you are receiving platelets or cryo, those are not placed in the cooler due to their storage requirements. On the bottom here, it is imperative that you also include your lab or blood number, and then the tech that releases the blood will place their number. This form will be kept for a minimum of 2 years in the blood bank to ensure accuracy. For areas that are ordering electronically, on the right here is a form from Epic, auto-generated when you print this form from Epic. The only thing that you have to fill out on the bottom is the blood bank ID number, as well as your lab code, date, and time. And then on the bottom, you can place the chart sticker right here. For those areas that need emergency release blood, we currently have in the emergency room and the OR, we keep 2 units of O negative and 2 units of O positive on cross-match blood. O negative can be used for females of childbearing age and children under the age of 15. For everyone else, males can receive O positive blood. This form over here is With each unit of red tag blood, we do include the blood number, the product, and then the expiration date. This will allow you to chart in Epic if you are unable to chart at the time of transfusion. Once the blood transfusion is given and data is charted in Epic, the salmon sheet needs to be returned to the blood bank. If you do come down to the blood bank wanting blood for your patient, it is essential that you provide the two forms, either the downtime form or the electronic form that is printed in Epic. If you come down with anything other than that, we will not be able to release blood product for your patient. Here are a few examples of what we have seen in the past. I call this an OR note card, a napkin, and a note card. If you do come down with this information, we are not able to release blood without the proper documentation. So why is this so important, and why do we care about the accuracy as well as the importance of monitoring blood transfusions? Because errors still do happen. A hospital this year in Springfield, Missouri ended up giving the wrong blood to the wrong patient. This was due to errors in the process, shortcuts related to failing to identify the patient with two patient identifiers, placing the wrong blood in tube, type and screen or a type and cross for a different patient, not verifying that blood was correct in the blood bank, also failing to verify at the bedside, not using the barcode as that fail safe, and not using a second person to verify. Some of the consequences for this case was harm, and the guilt and liability of knowing what you did potentially can cause harm to our patient. As I stated before, we do have coolers that we do release for patients getting more than one unit. Our circulators and red shirts are the ones responsible during a massive transfusion, whether it's in the OR or in different units that may be getting a significant amount of blood. If you're only getting one unit of blood, we will not provide a cooler. Coolers are only to be used for multiple units. If you do work in cardiac surgery, we have this Credo Cube, which is good for up to 12 hours. We do have a few coolers that do have timers on them that will remind you to return blood prior to that time period. If your patient no longer needs blood, it is imperative that you return the coolers in a timely manner. For those of us that like to donate, here at Erlanger, we typically offer a blood drive with our partners, Blood Assurance, to collect blood on site. Depending on your blood type, if you're negative just about everything except AB, they will take your whole blood, red cells. For those of us that are positive, meaning O positive, A positive, and B positive, the majority of the times they may only want your platelets or plasma. And if you're AB positive or AB negative, they're going to want your plasma. Platelets and plasma collections can take up to 90 minutes versus 20 to 30 minutes for whole blood donations. I'm going to play a short video here on why the importance of blood transfusions and patient blood management.
2 months is too little. They let him go. They had no sudden healing. To think that Providence would is appalling. Who told us we'd be rescued? What has changed and why should we be saved from nightmares? We're asking why this happens to us who have died to live. It's unfair. This is what it means to be held, how it feels when the sacred is torn from life and you survive. This is what it is to be loved and to know that the promise was when everything fell, we'd be held.
This short video was about Jessica Rose Kohut that received a contaminated platelet transfusion. The sad part about this story was this was a 100% preventable error that occurred. The day prior, a patient received the same products, platelet product that was a whole blood collection. This collection was separated into several different donations. Patient the day before received one of these doses, an adult who was able to fight off the infection. And the blood center, transfusion center stopped the transfusion and alerted the provider. However, the breakdown occurred when they failed to call the blood center, who would have pulled off all of these contaminated products. This little girl, unfortunately, was not able to fight off the infection on these contaminated platelets and went septic within a few days and died. It's imperative that we not only inspect the products that we are giving to our patients, but monitor our patients closely and also look at the products. If anything does not appear right when you're picking up from the blood center or when you're hanging the blood, we would rather have you stop the transfusion, alert the blood bank, alert your provider, and provide the right product for the right patient. And for those of us who are not familiar with giving blood products, particularly platelets, plasma, or cryo, we actually have resources that you can go to on the Erlanger intranet. If you go to employee links on the Erlanger homepage and you select Elsevier, clinical skills, this is a treasure trove of information on everything from medications, but in this case on blood transfusions. You type in blood, select transfusion, and search, and you can see all of the available information on blood products. If you have not given product before, a perfect good resource to review, or maybe it's been a while since you've done it. This quick sheet will go over some things to look for, remind you that you need a standard filter, and in this case, not to use fluid warmers for platelets. If you want to go into more details, you can select the extended text. It'll actually give you indications as to why somebody would need platelets, FFP, cryoprecipitate, and then also irradiated products. If you're unsure of the supplies that you need, you hit the supply button and it will provide you with materials needed. If you're a visual learner, you can select demos and you can actually see animation here of blood transfusion. You can see the date and time.
Ensure that informed consent has been obtained according to the organization's practice. Most policies waive consent in emergency situations. Consider that the patient's religious beliefs may prohibit the administration.
So this really walks you through the entire step from the order to obtaining informed consent and the documentation process. For those of you that want to prepare for the EOL, the online learning, we have 6 questions here on the yellow products, plasma, platelets, and cryoprecipitate. And then for those of you that want to review your process with your preceptors, we have a long list of checklists that you can go through to ensure that you're following proper procedure. And you can also go back and select other things related to blood, whether it's fluid warmers, red cells, pediatrics, fetal transfusions, massive transfusions, plenty of resources to review on Elsevier's website. Thank you very much for your time, and feel free to come to the blood bank, have a tour, or ask us any questions. We'd be more than happy to assist you. Thank you.